As hospitals have adapted to fight the demand from patients with the coronavirus, many have leaned on physician assistants like these men and women to help meet the burden. When Governor Cuomo stopped elective surgeries in New York State, many of the PAs who normally operate in the field were redeployed to fight COVID-19.
We're able to really move people to the areas of need and high volume where we were seeing a lot of COVID census patients, in the hospital.
Jason McGrade is the Assistant Vice President of PA Services at Northwell Health. Throughout its system, Northwell depends on about 1,200 PAs. And during this pandemic, he says they have been critical to the operations as they worked with doctors, nurses, and others in the hospitals.
And in many instances, the PAs with the critical care backgrounds, emergency medicine backgrounds, are really the team leader.
Because of the flexibility of our training in general medicine, many of those PAs in health systems like Northwell were able to be redeployed to work either in emergency departments, as hospitalists, in ICUs, where a great number of these COVID patients ended up, as well as in testing sites that were stood up to support this pandemic.
Even outside the walls of the hospitals, PAs have risen to the occasion for many patients in need of critical care. Mordechai Sachs is a primary care PA who practices just north of New Rochelle, where the virus originated in New York. In addition to his hours of telemedicine each day, Sachs shifted to make house calls when many of his patients were turned away from the hospitals. People, he says, would have been admitted if not for the overwhelming demand on our healthcare system.
I'm all geared up in my PPE, looking like a space invader, terrifying to the children for sure. And then coming home to my kids and trying to go nowhere near them as I, doff this gear, hoping not to bring anything into my home.
But like all of the medical providers during this pandemic, Sachs presses on each day as he focuses on the silver linings.
I am surviving. The spectrum of the things that I see are pretty awful on a regular basis, and I'm continuously reminding myself that it could be so much worse.
In other words, the effort is working. Joe Messeri, Pix 11 News.